Hi, I'm Dr. Bud Holcomb, and this is Psychiatry for the People. I've been a practicing psychiatrist in Austin, Texas for 20 years. Alcohol is so addicting. There is a very powerful and dangerous withdrawal syndrome when people stop. Early signs occur within 24 hours of stopping and include tremors, sweating, anxiety, increased blood pressure, and racing heart rate. These symptoms get worse after 24 hours and can lead to seizures. Severe withdrawal occurs in heavy drinkers after 2 to 3 days. Delirium tremens, or the DTs, include hallucinations, losing touch with reality, and severe agitation. About 20% of people with untreated delirium tremens die. We don't actually see that many active alcoholics in outpatient practice because they're usually too sick to get help. People usually seek help for alcoholism after they have hit rock bottom, which usually means hospitalization or being arrested. Treatment for withdrawal symptoms can usually be done as an outpatient. The benzodiazepines, such as clonazepam, lorazepam, alprazolam, and several others, bind to the same receptors as alcohol and are very effective treating alcohol withdrawal symptoms. Every doctor knows how to use these for this purpose. This is also the reason it's so important not to mix alcohol and benzos. They compound each other, so you are way more intoxicated, and they build a tolerance to each other, so you need more and more of each for the same effect. In my experience, after doing this for 20 years, alcohol is so addictive that people are unable to just cut back or taper by themselves. Although everyone who thinks they might drink too much has tried, probably multiple times. Alcoholics Anonymous began in 1935. There are now 55 million meetings each day in the United States and 85 million meetings per day worldwide. Any corporate 500 company would envy this staggering success. The reason is that we are primates and we need community. Remember, the reason people began drinking is to be with other people, and people drink to offset loneliness. To put it simply, the reason AA is so wildly successful is because it provides togetherness or non-loneliness without alcohol being at the center of it all. Where else are you going to find that? People suffer anxiety or being worried or scared. Again, they fear that if they stop drinking, they would be boring or have no friends because all their friends drink. They also have social anxiety and are afraid of joining a group of strangers. They make all sorts of rationalizations or excuses for avoiding AA. I don't like the religious aspects, or I don't want to sit around with a bunch of seedy drunks complaining. The fact is that with so many meetings each day, AA meetings come in all flavors. There are young hipster groups, retired musician groups, atheist or agnostic groups, Buddhist groups. The only common denominator is a desire to reduce your drinking, and that requires doing it with other people. While we need other people to maintain sobriety, that should be the only purpose of AA. Many 12-steppers look to AA as their main community long after they have gotten a handle on sobriety, and many people rely on AA as their form of therapy, but it is not intended for this. Alcohol was not the original source of people's emotional problems, and AA is not psychotherapy for the original anxiety and depression and shouldn't be looked to for that. However, you have to first turn off a broken faucet before you can clean up a mess. Thanks for watching.